Is near-death experience, NDE, trauma a form of PTSD? Imagine facing a situation so intense that your mind perceives it as life or death. During such moments, some people report vivid experiences known as near-death experiences. These can include feelings of floating outside the body, seeing a bright light, or feeling a sense of peace. But does experiencing an NDE mean you have post-traumatic stress disorder? Not necessarily. Post-traumatic stress disorder is a mental health condition that develops after a person encounters a traumatic event involving actual or perceived threats to life, serious injury, or sexual violence. Symptoms include intrusive memories or flashbacks, avoidance of reminders of the trauma, negative changes in thoughts and feelings, and heightened arousal or hypervigilance. For an event to be classified as traumatic enough to cause PTSD, it must meet these specific criteria. Near-death experiences happen during situations of extreme danger or perceived imminent death, which can be considered traumatic. Because of this, some individuals who have had NDEs may develop PTSD symptoms. They might experience intrusive thoughts about the event, avoid places or situations that reminded them of it, or feel anxious and hyper-alert. However, not everyone who has an NDE develops PTSD. Some report positive changes afterward, such as increased appreciation for life or reduced fear of death, known as post-traumatic growth. Research shows that the psychological impact of an NDE varies widely. While some individuals may experience distressing symptoms consistent with PTSD, others do not. The key factor is whether the person develops symptoms that meet the diagnostic criteria. Simply having an NDE does not automatically mean someone has PTSD. It depends on their subjective experience and how they respond afterward. Clinicians carefully assess NDE survivors for PTSD symptoms. If someone shows signs like recurring intrusive memories, avoidance behaviors, mood disturbances, or hyperarousal, and these symptoms persist over time, a PTSD diagnosis might be appropriate. But if the person reports feeling peaceful, enlightened, or experiences positive psychological changes, then their experience might not be classified as trauma-related PTSD. In summary, while near-death experiences can be traumatic because they involve situations of perceived imminent death, they are not automatically PTSD. Whether someone develops PTSD depends on their individual response and whether their symptoms align with established diagnostic criteria. It's important to remember that each person's experience is unique. Proper assessment by a healthcare professional is essential to determine if PTSD is present and to guide appropriate treatment. Understanding this helps us see that trauma and its effects are complex. Not every life-threatening event results in PTSD, and some experiences, including NDEs, can lead to positive psychological growth. Always seek personalized medical advice if you or someone you know is struggling with trauma-related symptoms.